Any further ado, I'm going to welcome our speaker. Her name is Dr. Ashley Walsh. She's an OBGYN with Gainesville OBGYN Physicians. They have two offices here in Gainesville and one in Lake City. I'm sure she's a busy lady, but she gladly accepted the invitation to come and speak to us today, so we really appreciate her. So if you don't mind, join me in welcoming Dr. Ashley Walsh.
Thank you so much for having me. Thank you very much. Hello, thank you all for coming and spending some time in your day just to listen and welcome me here. For the gentlemen in the audience, I am an OBGYN, so this will be more focused on your female loved ones in your life, but definitely info that you can pass on to them as well. So this talk originated as a kind of a New Year's resolution talk, things that we need to kind of pay attention as the year starts. So June is a great month, kind of middle of the year, things maybe we planned on thinking about in January that got away from us, we can start thinking about again for the second half of the year. Very informal. If you have questions, please ask, and I'm definitely available for questions afterwards. So according to Parade magazine, the top 5 New Year's resolutions are lose weight, improve finances, exercise, find a new job, and eat healthier. So the majority of these resolutions include something about wellness, losing weight, exercising, eating healthier. You know, wellness is always at the top of our list of things that we want to improve or focus on. So for women's health, my specialty, what can we do to focus on getting the most healthy we can in 2016? Things that I'll be going over are just some guidelines, the recommendations based on scientific evidence of when we should do our screenings and why. Some of the focus will be including for Pap smears, mammograms, colonoscopies, and our bone density. And then just some reminders of things that sometimes we also let go through the years and through our day. And we'll go through these each a little bit more, just reminders for staying as healthy as we can. So as an obstetrician gynecologist, I like to focus on the annual exam. A lot of women kind of say, I don't need to go every year, or I don't need to see a doctor. And men are very, say this a lot as well. What do we do at an annual exam? Why do I need to go every year? And so, you know, it provides opportunity for discussion, questions that you may have about your health, about your lifestyle, and what you can do to maintain your any health risks you have. It's also a time to go over any screening, evaluations, make sure your immunizations are up to date, which is very important for staying healthy. And then it's also surprising how early this exam can start. Even young women, age 13 to 15, I know some of you probably don't want to hear this, but we should start talking to them about safe sex practices. Certainly not with an exam. You know, most women that age are not sexually active, but having an adult who they can ask questions to that are hard sometimes to discuss with mom or dad, and definitely sex we don't always want them talking with their friends about either. So the annual visit can be a time for young women to ask questions that they maybe feel uncomfortable asking parents about. So the Pap smear, it's kind of what gynecologists get their name. This is what the annual exam used to be thought, this is what they do there. So what is a Pap smear? It's a screening test for cervical cancer, and that's why we do it. It's started at age 21, regardless of sex practices. The starting age should be 21. So women used to have them starting at age 15, 18, 21, regardless of any risk factors is when the first Pap should be. If those PAPs are normal, it's every 3 years. So again, it comes down to they don't need a PAP every year. It's an every 3-year test. And then as women age, it becomes even more spaced out. As long as all the Pap smears are normal, women over age 30 need one every 5 years. So definitely kind of getting away from the thought that an annual exam equals a Pap smear every year. The reason this is spacing out is because we're finding more and more out about the HPV virus, and we'll talk a little bit more about that. But basically that is the virus or the strain of viruses that are most closely related with cervical cancer. And as we can screen for these viruses and find out if women have them, we can guide their screening more to them as a person instead of a general population. Of course, if there's an abnormal Pap smear or if that virus is detected, your screenings will become closer together and sway from these general statements. So the HPV virus, there are over 100 different strains, 40 of which have been associated with actual cervical cancer. Of these strains, there are two, 16 and 18, that are account for over 90% of cervical cancer. So yes, there are a lot, but we've really narrowed it down to the two main culprits. It's very prevalent. 80% of sexually active women and 90% of sexually active men at some time in their life have this virus. So it is very prevalent. Thankfully, in young, healthy people, we most likely get rid of it. And so it's not something that we have to worry about. When it does not eradicate itself or when our body does not get rid of it, that's when we have to watch it more closely, and that's what the Pap smear does for us. Like I was saying before, one of the other reasons we've been able to space out Pap smears is because we're now at age 30 testing every woman for that virus with a routine Pap smear. And so we can say at 30, you do not have it at this point, your screening can stay at 5 years, or you have been exposed and we need to watch it more closely. So what can we do about this darn virus? There's a vaccine. Right now it is recommended for younger populations, so it's great for pediatricians and myself, OBGYNs, to really promote this vaccine. It's recommended for males and females ages 9 to 26. Almost every single insurance will cover it within those age ranges. The vaccine, the most recent one, has been extended to cover 9 subtypes of the virus. Again, there's over 100, but we have narrowed it down to the two that cause the most cases of cervical cancer, as well as genital warts. And then just again, there are other strains, but we have a vaccine to protect against the 2 most common and 9 total subtypes of the virus. Moving on to breast health, so the mammogram. There's a screening test for breast cancer. It's called the mammogram, and it's a imaging study of the breast. There is some data, some new guidelines coming out from different cancer networks that are saying mammograms should be spaced out, not needed every year. The American College of Obstetrics and Gynecology recommends continuing a yearly mammogram. There is not felt to have enough evidence to change those guidelines as of now. So it starts at age 40 for women unless they have a family history of breast cancer, they have a known genetic disposition. The one that is most commonly heard about is BRCA or BRCA. That would change from the general population because those women are at an increased risk of developing breast cancer young. Again, a yearly breast exam with the annual visit is another reason to come to your yearly exam. And we're promoting self-breast exams or breast awareness. I have a lot of women that tell me, I don't know how to do it, I don't know if I'm doing it right. And so I personally like to get away from telling a woman to do an exam and just basically knowing their breast tissue, recognizing if something was different, something was growing or tender, they have a relationship with their breast and would be able to recognize a change. So there is no wrong way to do a self-breast exam. I get that a lot. Colonoscopy. This, gentlemen, everyone needs to know about this, male and females. It's a screening test for colorectal cancer. Starts at age 50. Again, unless there are significant risk factors, then that screening should start younger. They recommend, the guideline is to have one every 10 years. If there is something found, for example, a polyp at that first colonoscopy, your screening again will shorten. So about every 5 years if a polyp is found. Colorectal screening and cancer, the screening of a colonoscopy is one of the best screenings for cancer we have. We know that those polyps, those adenomatous polyps that are found are what, if left alone, can cause cancer. So if they can be removed as a polyp, you've effectively significantly decreased your chance of developing colon cancer. It's one of the best screening exams we have. And then again, high risk individuals, if you have a family history or a personal history, and again, that genetic predisposition to colon cancer would definitely increase your screening and would start it younger. Bone density screening. So our bone density significantly declines after menopause, and that's mainly because of our decrease in estrogen for women. This causes an increased risk for osteoporosis and fracture, and hip fractures are a significant cause of morbidity and mortality in elderly men and women, and so it's an important thing to recognize and be aware of. The DEXA scan is what is used to screen for bone density. So if someone tells you need a DEXA scan, that's basically what a bone density screening is. You will start that screening at age 65, again, unless there are other risk factors. So women that are postmenopausal with any of those following risk factors should have them earlier. If you have a history of a fracture, weight is important. Thin individuals are more likely to develop osteoporosis. And medical causes of bone loss, for example, steroids cause bone loss, diabetes can cause bone loss. If there's a personal family history, your mother had a fracture in her femur or her hip at a young age, smoking significantly affects our bone density, and that is an indication for a more earlier bone density scan. Alcoholism, and then rheumatoid arthritis. So it's a bit of a random list, but all would be an indication to need a bone density scan earlier than age 65. So now these are just some health tips, going back to 2016, trying to live healthy and increase awareness of what we can do to be healthy. Number one, quit smoking. It is so important. It is hard, very hard. Tobacco-Free Florida is a great resources. There's a lot of resource in the community to help people quit. Lung cancer is the most common cause of death in women, and over 80% of that is directly related to smoking. Other side effects, COPD, asthma, osteoporosis that we talked about. In younger women, smoking is associated with increased risk of infertility, and certainly in pregnancy can have adverse outcomes on the baby. Again, not an easy thing, but certainly something when we're talking about health that should be high on the list. Just a little bit of review of vitamins and supplements. There's billion-dollar industries about what to be taking, and so in women of all childbearing age, it's recommended to take a prenatal vitamin. Folic acid is very important in prevention of neural tube defects. In this country, about half of pregnancies are unplanned, and so by making a general blanket statement that all women are on a prenatal, it significantly helps reduce the risk of spinal neural tube defects. DHA is also included in almost all prenatal vitamins, which has been shown to help babies' eye and brain development. Speaking about osteoporosis and bone loss, calcium and vitamin D are very important in the prevention of bone loss. And our bone health declines after about age 35. And so even 35 and older, I recommend my patients taking calcium and vitamin D supplement daily. Vitamin D is getting a lot of press. Now we're finding most people are deficient in vitamin D. We're just not going out in the sun as much because of other risks related to sun exposure. Our sunscreen is better. And so we're finding that most people are deficient in vitamin D. What that means long term for our health remains to be seen, but definitely most people should be on a vitamin D supplement. Something else to talk about in health tips is safe sex. So sexually transmitted infections are the most common contagious infection after the cold and flu. So they're very prevalent. What can we do to prevent them? Number one, use condoms, know your sexual partners, avoid risky sex practices, and then vaccinations. HPV is considered a sexually transmitted infection, and we have a vaccine against HPV. Just to review a little bit of options for pregnancy prevention, we talked about condoms protecting against STDs, many hormonal options, LARCs or long-acting reversible contraception is what's recommended by the American College as what should be offered as a first line because they last for a long time, they're not permanent, and the woman can choose when to have them removed and then therefore be able to plan her pregnancies. An IUD is a device that goes inside the uterus. There's many different options, including non-hormonal. options that are good for 3, 5, or even 10 years of contraception. Again, they're not permanent and can be changed at any time, so you don't need to have them for that long. And then the Nexplanon is inserted into the arm, again, a long-acting contraception. And then just the last ended on sun exposure in this beautiful state of Florida in July. Skin cancer is the most common cancer in the United States, and it's just a reminder that tan is a burn, is skin damage. Avoid tanning beds, wear sunscreen, long sleeves if possible, and starting young. So definitely it makes me cringe a little bit when I see young kids so tan, because a tan is a burn and it's definitely skin damage. So make sure those babies are protected, wearing long sleeves, and have their sunscreen on. It's a very old quote and still true today. We are nothing without our health. The greatest wealth is health. Thank you.